first to just kind of get some definitions out of the way and kind of what we consider as the terms overweight or obesity. Our body does have a normal function to have and store body fat. In the medical sense, we refer to that as adipose tissue, and it's really vital for a lot of different functions of the body. So it helps us store energy for when it's needed, just for day-to-day activities. It provides a lot of support and cushioning for our vital organs. It helps us regulate our body temperature. And then it also plays a big role as far as different signaling pathways for our hormones, functions of our immune system, and then also regulating inflammation in the body, whether that's helpful or harmful. And so when we consider excess adipose tissue or body fat, it's usually when we get to a point beyond our body's set point of we're consuming a little bit more calories or what we would consider energy beyond what our body needs for its day-to-day function. So that's kind of what we see when we say calories in versus calories out. And I always like to point out that when you think about it from a physiologic sense, it makes sense why it's so hard for people to lose weight and to maintain weight loss, because our bodies really weren't designed to function that way. I mean, you think back to ancient societies, our ancestors, where people were hunting, gathering, farming, doing very physical work to store up food because we didn't know when it was going to be available. And if you were in a deficit of calories, your body was kind of in crisis mode. And now our society is evolved so much where food is in abundance. We don't have to go very far to get our calories. A lot of us live lives where we don't necessarily have to be physically active to maintain our lifestyle. So it kind of makes sense where there's an energy mismatch. So kind of taking that information and applying it to what we do in a medical setting. When you go and have a visit with your primary care provider, you're probably familiar with the term BMI or body mass index. This is used, it's based off a study that was actually done in the 1800s and has been continued to be used just because it's somewhat standard. It does have some good correlation with health, but it's not perfect. It was a screening tool that was based off of European white males, so it doesn't take into account, female body types as well, other ethnic or racial considerations, but it does give us kind of a baseline to compare what in general might be a standard body size. And so you can see from the scale, what we would consider as far as number ranges based on age and height and weight, where you might fall into an underweight, normal, healthy weight, or overweight, or different stages of what we would term obesity. So we use it in medicine, but have to acknowledge that it's not perfect. Another measurement that we do use to assess weight and health status is a waist circumference. And so kind of shows with the diagram and then down below of how this measurement is taken, with a tape measure just above the hip bones, kind of along the navel, held flat, kind of parallel to the floor, being snug but not too tight. You can get a sense of where your waist measurement might be. This is important because we have found that a larger waist circumference does have an association with increased risk of heart disease, stroke, type 2 diabetes, as well as certain cancers, because it gives us a sense of how much of that adipose or fatty tissue is visceral fat. And if I go back to this diagram, we can kind of see this is that internal storage of fat that surrounds our organs. And so that is considered to be a little bit higher risk for certain health conditions. And then why is this important? Beyond a person's, body size, we have to consider how much excess weight puts us at risk for certain health conditions. And, this is all going to be to varying degrees, but we have, research to show that a little bit of excess weight does put you at risk of some health conditions with multiple organ systems within the body. From your nervous system, some reproductive complications, beyond what you normally think of cardiovascular disease with heart disease or stroke. There are a lot of different things that excess weight can affect. And, when you're seeing your doctor, when we're trying to address your overall health status, these are some of the things that we have in the back of our mind that we really want to either help you address and reduce your risk factors for, or if these are some conditions that you're dealing with already, how can we reduce that risk and get you to a good state with your health? So like I mentioned, the BMI scale isn't perfect, but it is what we kind of use universally. We're kind of moving more towards, especially with providers like myself who have a little bit additional training with weight management, is putting BMI classes more into stages. So you might be aware that even if your BMI falls in a certain number range, you might not have all of these, specific diagnoses that we're mentioning. It might not affect your health in a significant way compared to somebody else. And so this just kind of highlights that we're looking at, okay, what stage might you be with your specific number of BMI? Are you seeing any medical risk factors? Are there any significant impacts on your mental health? Do you have some physical limitations as a result of some excess weight? And this next table kind of highlights, there's a lot of information on here, but as you can see, that stage 0 means, okay, my doctor told me that my BMI is in a little bit higher category, but I'm feeling really good. My labs all look really normal. My blood pressure and vital signs are normal. My mood is generally good, and I really don't have any day-to-day limitations with my body. But as we move on, you might notice some of those more insidious symptoms like, okay, I do have a little bit of concern about how I look or how I feel. I'm getting a little bit more fatigued during the day, a little bit more winded when I'm active. When I go for my health visits, they have told me my blood pressures are a little bit borderline. Those are kind of the signs that maybe we should talk about, what we can do to get you in a little bit better place before things progress a little bit further. Further on the stage, we do have more of those diagnoses like you saw on that picture where people are seeing, more joint pain. Maybe you do have a diagnosis of high blood pressure or type 2 diabetes. And what can we do to help you manage your weight concerns, to help reduce maybe the number of medicines that you take, or how we treat and address those concerns. And as you can see, we get all the way down to kind of the more severe implications of that. So we have that background information. What do we do about it? How do we get to that point of weight loss? And the truth is, it's extremely complicated. So just like this slide is very busy, that is how difficult it is to really address weight loss for most patients. We have things that we can't change. We can't change our genetics. Sometimes we can't change, our financial situation, which gives us certain resources. Sometimes our religious or cultural background dictates kind of the foods that we eat and our lifestyle. But there are a lot of modifiable risk factors that we can help you address, and some things to do with habits, or maybe just a little bit of education on certain nutrition items. And sometimes that does include use of medications to get you to a place where you want to be. But the main point of this slide is just to demonstrate how complicated it is, and we understand why it is so hard to lose and maintain weight. So where do we start given that information? And the best place is to get in and have a physical or a specific visit with your primary care provider. You know, they know you best, they know your history, they can review that with you and see what you might be at risk for, what might be indicated based on your health history or any new symptoms that you're reporting to them. Um, Kind of a basics of a visit, if not being done already, that you should ask for is to ask, how is my blood pressure in compared to healthy ranges? Where do my cholesterol levels or my blood sugars lie? And you know, if that's not being discussed, please ask them to explain where your levels are in comparison to healthy ranges. Making sure that you're up to date on your regular cancer screenings based on your age and your risk factors. And sometimes, based on what you discussed with your doctor, you might be needing some additional blood work to see if there's any other health conditions that might be contributing either to weight gain or inability to lose weight. So that's always important, and that does vary widely person to person, so kind of hard to summarize, but best to just ask your health provider what they think might be indicated for you. So just to kind of give you a sense of when somebody comes to me or anybody else in the medical field about saying, I'd really like to focus on my weight, where do we get started? We kind of use this period to get our pyramid to see, okay, based on where a starting BMI is, based on if people have medical comorbidities like diabetes, heart disease, etc., where would you fall and where might you best benefit? And we always start at the bottom, regardless of BMI or health conditions, because we know that lifestyle modifications, without addressing that and seeing if there's anything that we can improve, no medication, no surgery or procedure is going to help sustain long lasting weight improvements. So can't emphasize that enough, that we always pair that bottom pyramid with any other intervention that we're looking at. So some things that we talk about, you know, it is always good to get familiar with, okay, what is a good calorie goal for me? There's a lot of good calculators that you can find online to get a sense of, okay, what's my baseline basal metabolic rate, or how many calories does my body burn just at baseline without any extra activity that I do during the day. You know, that calorie goal is going to vary widely based on whether you're trying to maintain your weight, lose weight, or if you're trying to gain weight for any certain reason or health condition. I do find that tracking apps can be helpful. I say at least try it for a few weeks or a couple months. I know they can be very tedious, and I never want anybody to obsess over calorie tracking. I don't think that's healthy or useful, but it is a good educational tool because, you know, even myself with my education, there's always things that I have in my diet, like, oh, I punched that in, and really surprises me how many calories or grams of sugar that I'm getting in something that I didn't realize wasn't entirely nutritious. It's also helpful to get familiar with what a healthy serving size is. Get familiar with reading food labels on what you purchase, and they will say what a good serving size is in most scenarios. And you know, the basis of good healthy diet, there's a lot of fad diets out there, and there's a lot of discussion that could surround that, but my opinion is focus on whole foods, foods that are as closely matched to how they appear in nature. So lean meats, you know, whole grains, fruits and veggies, things that are not super processed or packaged. That's going to be the best bet. They're low inflammatory. You're going to get good vitamins and nutrients that you need day to day. So that's always the best place to start. And this kind of adds a little bit of extra detail of ways that we can address this. You know, as best you can, try to cook at home often, because whether we're aware of it or not, most restaurants, fast food chains, There's a lot of additives, there's a lot of added calories because they want food to taste good. If it doesn't taste good, then people aren't satisfied. And a lot of times that means adding things that aren't always the healthiest for us. And so if you can prepare meals at home, that's going to save you a lot of extra calories. If you do go out, which, I encourage people to still have, social events, go out, enjoy yourself, but maybe take a peek at your portion sizes. Most restaurants serve way more than we need to feel full or satisfied. So think about sharing a meal or asking the waiter, waitress to box up half of your meal before you even start eating. And then you have another meal for later. Look at what you're adding as far as condiments. Sometimes we go through the salad bar and we think we're making a great healthy choice, but if you look at some of the salad dressings like regular ranch, a tablespoon or two, you're approaching 100 calories just in a little bit of an additive. So while you're thinking you're making a great choice, some of that really adds up fast. So something lighter like an Italian dressing or vinaigrette is going to be a better option to reduce some of those added calories. Some other options there to kind of consider, but stress and mental health are extremely important. We do know that when stress levels are high, our cortisol levels are up. We tend to have more appetite. We tend to eat things maybe we didn't intend to eat when we weren't feeling stressed. So always good to find healthy coping mechanisms to address that. Similarly with sleep, when we're having poor sleep, appetite also increases. So kind of if you're having sleep concerns, address that with your doctor as well. And this is where, our resources are extremely important. Our registered dietitians are a wealth of knowledge. We don't get a ton of very specific dietary education. And so we really turn to them for those details, and maybe you need a special diet in regards to your personal health and your conditions. And sometimes, I frequently reach out to our mental health providers because I have a lot of patients who need a little bit of guidance as far as, okay, I'm really struggling, I'm really stressed. I turn to food when I'm feeling happy, when I'm feeling sad, when I'm feeling tired or bored. We do have some great mental health providers that can help coach you through and kind of discuss strategies of how can we find those mechanisms to, have a little bit of healthier habits in response to some of those feelings. Just kind of briefly, this is something that I let patients know about to help them tune into their hunger cues. You should always kind of listen to your body and get a sense of, okay, am I really physically hungry? How hungry am I? If we're finding that we're ravenous, it's probably an indication that we need to add a little bit more throughout the day to keep us from getting to the point where once it's, lunchtime, supper time, we really end up eating more portions than we intend to because we waited a little bit too long to get those nutrients in the body. If we're feeling stuffed, maybe slow down our eating a little bit, focus only on the meal, turn off the TV, put away the computer that you might be doing work on, and, kind of tune into, okay, I'm feeling satisfied, I'm getting a little bit full, I'm going to stop now, even though I could eat more, because I know if I keep going, 15, 20 minutes later, I'm going to be uncomfortable, that sort of thing. So, and then just, kind of identifying those triggers of kind of keeping some of those, foods that are tempting out of the way, plan ahead for when you're busy and fatigued, for what you're going to do during the week and, tired and not really wanting to spend a lot of time cooking. So exercise, the World Health Organization recommends that we all try to get at least 150 minutes of moderate intensity exercise per week. This is on average. And 2 days a week should include some form of muscle strengthening activities. So moderate intensity, meaning, your heart rate's picking up, your breathing's a little bit faster. You don't have to be drenched in sweat or exhausted, but you should be noticing that you're working a little bit harder. Using a smartwatch or a step counter can be helpful to kind of track your progress and kind of slowly increase, the form of activity that you're doing. if you do experience back pain, joint pain that kind of limits your mobility, try to look for kind of those more low impact exercises. Those are going to be your best bet. And then maybe your pain improves. You feel a little bit stronger and more confident moving on to some other activities. There's a lot of great resources where if you don't have access to a gym or a gym membership, of stuff that you can do for free at home and even without any equipment and just your body weight. So I'd encourage you to kind of check some of that out. But the biggest thing with exercise is pick something that you like. You know, I could say everybody could go and get on a treadmill and go for 45 minutes. And, you know, you might do it one time and hate it. And that's not something that you're going to want to continue or stick with. So it has to be something that you enjoy, that you look forward to doing because it makes your body feel good when you're done. And so that's going to be different for everybody. And there are studies that show when you have a partner, when you're doing it in a team or, you know, an exercise class, that motivation is there. It's usually a little bit more enjoyable when there's some form of social, either accountability or social aspect to it. Kind of setting a goal for what you're going to do. This is just some examples of how to frame your mindset with it. A lot of people have these kind of vague goals where I'd really like to exercise, or I really think I need to get more vegetables in my diet. Well, that's great that people are thinking that way, but how can we frame it in a way that's more realistic? And so instead of saying, I want to exercise more, kind of use these tools to make it more specific and have, you know, some kind of time frame to it. You know, I'm going to walk around the neighborhood for 20 minutes on these days for 1 week. And once you've accomplished that goal, you can always move on and set a new goal. Maybe it's, you know, more minutes, maybe it's more days out of the week, or apply it to something different that you want to try. Similar to things with the diet, just to kind of really frame it in a specific way that's easier to carry out. And so from a medication standpoint, when patients come to me and they're thinking, I've done all these lifestyle interventions, I really think that I could use some extra help. These are always things that I think about. This was a study done by Dr. Acosta with the Mayo Clinic, who looked at what they consider obesity phenotypes. So things that, you know, how people respond to things in their environment in relation to hunger and sense of fullness. So one being the hungry brain, where people feel like it's physically they might feel satisfied, but the brain is like, I just feel like I could have more. You know, hungry gut, where I know I've had enough to eat, but I just really feel hunger. Like I just feel like I had a full meal and I could keep adding to that. Emotional hunger, where maybe you do have a sense where, you know, there are things during my day where I'm stressed or sad or, you know, even happy for some patients, and they just feel that drive that their emotions are playing a role in their hunger. And then slow burn is a little bit more difficult or rare when there are certain physical activity, physical conditions that are affecting their energy expenditure. And so their metabolism is a little bit slower to respond. Kind of considering that thought process, these are some of the medications. There's not many. There's more on the market and lots of research to come of what might be available to patients, but this is kind of what we've had available. Some of the efficacy of medications isn't totally up to date in this table, but the outline is helpful, I think. We have a few oral medications that kind of work towards different targets of those phenotypes. So one kind of helps with, you know, reducing fat absorption, but sometimes comes with more side effects. You know, two of the other oral options, both in certain ways, focus on a little bit of appetite suppression, but also, you know, more of that mental chatter that's surrounds food, where people may feel physically hungry, but having that desire to reach for additional foods or snacks throughout the day. And then kind of big in the news are the injectables. And these involve a lot of different hormonal signaling pathways, kind of mirror what we've done with treatment of diabetes, but then also shown some progress with weight loss too. And so this is kind of a little bit of medical jargon, but just kind of shows how there's certain medications, certain referrals onto even surgery for some patients when we consider what category they might fall into. And sometimes it's a mix, and it involves a little bit of interplay between how we treat these conditions. If patients have questions about surgery, I don't touch on that today, but it is a discussion that you could certainly have with your doctor if that's something that you have questions about. And I do get a lot of questions about the injectable medications. They are based on the hormone that we naturally create in our body called GLP-1. There's also another medication that combines two hormones, GLP-1 and GIP, that have similar but slightly different effects. Without getting too in depth with the biochemistry of it, this diagram just shows that it does have a lot of effect on different organs within the body, whether it's, how fast your gut processes what you're eating, slowing digestion, how responsive your cells in your body are to insulin, and how you process glucose or blood sugar in your body. And then what it doesn't totally illustrate is the effect that it has on the brain and the signals that it says that, I am full, I'm finished eating, I am satisfied, where people feel like they have less of that hunger signal. And so we are seeing a lot of benefits from these medications in a lot of different health conditions. And so there's a lot of promise, a lot of research going into these. I will say that they are not a cure-all. A lot of things on the internet would suggest otherwise. They're not for every patient. Most research is showing that in order to get the best benefit, this is meant to be a long-term process of treatment, similar to if you would take a medicine for a thyroid condition, you may benefit long-term from that. You would similarly need to maintain something like this for your health. So it's not meant to be a temporary quick fix. And there are some side effects that can come with them, but a lot of potential benefits as well. They're very costly is the main barrier. And it's very hard at times to get our patients insurance coverage, even when there are good indications for using them for health. Just a word on dietary supplements. I get a lot of questions on if there's any supplements that are helpful for weight loss. And the short answer is we don't have a lot of great evidence to recommend anything in particular that's out on the market. It's a multi-billion-dollar operation in weight loss industry to try to push certain supplements that may help. A lot of times they're very expensive, and we just don't know enough to say, yes, this does have any proven benefit. Not to say that anecdotally some people might have success with certain things. We just don't know enough to say, yes, this is effective, or is this safe? That's the big thing. You always want to talk with your doctor about any supplements that you're considering taking, because there are ingredients in them that may interact with medicines that you take for other reasons. And sometimes it may be impacting, other things with your body. We see lab abnormalities that you may not know about until we check and know that you're taking. So just mention it to your doctor if you have questions. So kind of bottom line again, I really encourage you to get in with your health provider and just discuss what kind of plan would fit your lifestyle, your unique health history. There is no real one size fits all, so that goal should be and plan should be very individualized. And we also want to focus on things that are not only realistic for you, but also sustainable long-term, because if we are seeing weight loss and making progress, we want to make sure that that's going to be lasting for you and nothing that's going to be short-term or kind of a yo-yo effect. We want this to be long-lasting. And I always tell my patients, when you're on this road, this journey, think about making progress. Don't focus on perfection. There are going to be ups and downs. There are going to be weight plateaus. There are going to be times when you know your diet or your exercise routine aren't perfect, but please don't get discouraged by that, because it is a journey. And so you think about how many years sometimes it takes to put weight on. The same is true about taking weight off. So I think we all deserve a little bit of grace with that. And I know that it's not easy. So we just want to encourage you and help provide you with the information you need, to talk with your doctor about how that might affect your health and how you can meet your goals. So.